Health of the Public by Giuseppe Francioni. A little overview of what we're going to be talking about today are roles and responsibilities, organizational structures, legal and ethical realms, funding, communication, and the thesis statement for this project is public and community health are essential to achieving the goal of a healthy civilization. And this is all in the realm of the responsibilities of community and public health. So jumping right into it, health is an important part of the way we live. Simply put, if we don't take care of ourselves, we cannot expect to live on this earth for very long. To accomplish this, it's not only the individual's responsibility, it's the community's. The community must come together in an understanding of what is healthy and what is not. As the price of healthcare continues to skyrocket, it's important that the community maintains a healthy lifestyle to counter these financial burdens. A healthy lifestyle requires two things, which are being active and having an appropriate diet. An appropriate diet is one that is comparative against the My Plate chart as to the amount of food an individual should consume. According to the book Community and Public Health, the author states that only 32% of students ate at least 2 servings of fruit each day, and only 13% ate at least 3 servings of vegetables a day. And lastly, only 24% of the U.S. adults ate 5 or more servings of fruit and vegetables each day. So this is a considerable impact on the community's health. Now moving on to public health, it's the public's health goal. Public health is the goal in which the community is trying to obtain. To accomplish these goals, it's a responsibility of enacting programs in order to achieve the community's goals of health. This is achieved through social, economic problems that affect the community and counter them at a larger level. An example of this will be the focus on the revitalization of school districts to counter the current obesity rates affecting the United States. These programs are in place to adjust and adapt to social needs and make the adjustments back to a healthy lifestyle. Next, we'll talk about organizational structure. The structures of public health organizations are quite complex, involving many different organizations and people. These levels are national, regional, and local. At the national level, the government is responsible for ensuring the public health through policies. This has become quite clear in recent years with the release of the Affordable Care Act. This act is set in place to ensure every American citizen has the ability to acquire health care coverage at a reasonable price. At the regional level, the organization establishes standards to support these policies. This is accomplished through the dissemination of information. This is where lead organizations such as the CDC and FEMA play a role. The CDC and FEMA have been established to produce safety measures to ensure the reduction of possible outbreaks that might affect the health of the community. These organizations often step in and aid and support events that impact regional and even national health. The last level is local, which is also the state. Inside the state, several organizations exist to support the health and well-being. These organizations are first responders, which are the firefighters, police officers, and emergency care units. These individuals do a majority of the hands-on work, ensuring the community is safe and healthy to live in. These individuals also uphold the written policies specifically established for their state government. Although it is widely understood that the transition of public health into local authorities has great potential to provide improvements to the public health. 15% of the public health professions believe that changes have currently had a positive impact on health outcomes. The next aspect we're going to talk about is legal and ethical realms. As previously discussed, the government is responsible for writing policies that support the better good of the population as it relates to their health. These policies are enacted to support the ethical dilemmas that often cloud individuals' abilities to do their jobs. An example of these policies are the Health Insurance Portability and Accountability Act of 1996, the Privacy Act of 1974, and the general public policies. The Health Insurance Portability and Accountability Act, also known as HIPAA, was established to prevent the loss of privacy of medical patients. HIPAA increases privacy medical records through electronic and paper copies. Very similar to HIPAA is the Privacy Act of 1974. This act protects the misuse of federal records such as Medicare, Medicaid, and other government-funded health services. And lastly, the general public policies are policies that protect the public from injury or go against the public's good. Due to these ethical reasons, it prevents state laws from being made that support any non-ethical behaviors. While there was only 3 policies currently named, we currently have far more that support the legal and ethical dimensions of public and community health. All public health dilemmas involve core ethical and legal issues. Strategies designed to deal with these problems are rooted in the study of law and ethics. In fact, there is no issue in public health that does not have roots in law and ethics. According to the medical journal written by Agby, all public health dilemmas involve core ethical and legal issues. Strategies designed to deal with these problems are rooted in the study of law and ethics. In fact, there is no issue in public health that does not have roots in law or ethics. Next thing we're going to talk about is funding. In order for the public and community health services to function, they must receive some type of funding. This funding comes from grants, employee-based insurance companies, Affordable Care Acts, Medicare, Medicaid, state and local governments. These program allotments allow individuals to receive healthcare services at free or reduced rates. This is vitally important to the impact of the overall population. These funding programs allow individuals with inadequate funding or that are not able to or do not have the ability to seek health care. In addition to the programs already named, there are around 1,600 funded programs to support the public and community health services. One of the most popular programs is the Affordable Care Act of 2010, also known as the ACA. This act enabled the ability for all U.S. citizens to gain health coverage at an affordable rate. The creation of this program was to produce a healthy community through the public's involvement. The more people covered by insurance, the more money that goes into the healthcare system. This is crucial to the sustainability of healthcare in the United States. The next funding program is Medicare, which is a program that provides insurance coverage for individuals under the age of 65. Medicare covers nurses, nursing care home, hospice, preventative services, hospitalization, screening, medical supplies, home health care services, and doctor visits. And the last program that we'll talk about is Medicaid. And this program is for low-income individuals under the age of 65 years old. This program varies from state to state, but is generally applicable for anyone with an annual income of $15,000 or less. Public and community health services allows individuals to gain access to coverage they need. Without these government programs, the overall health of the community would be severely impacted. And the last thing we're going to talk about is communication. Communication is a vital asset in not only life, but also in the healthcare field. Two of the more common forms of communication are verbal and written. Verbal communication can be further broken down into one-way communication and two-way communication. One-way communication is where one individual speaks an idea or thought. The second is two-way communication, where two individuals express ideas and thoughts through words of a similar language. The role of communication in the community and public health programs is to ensure compliance with the programs. Without communication, you would not be able to express ideas and thoughts towards improving the overall health care of the community. An example of communication would be an emergency broadcasting of a tornado. The broadcaster verbally speaks the information that is important to the protection of the community. Another form of communication is written communication. This type of interaction is typically on paper or a computer. This type of communication is an important part of the healthcare as it relates to comprehension of the material being discussed. An individual having surgery must receive a contract stating that they understand what is going to be done, and the hospital will not be held reliable. There is also a policy which was discussed earlier that provides ethical and legal backing to prevent the maltreatment of the community in public health programs such as ACA, Medicare, and Medicaid. And according to Bernhard, communication is essential to promoting and protecting the health of the public as a major milestone in the emerging discipline of public health communication, reinforcing its vital role as a new core component of public health. So in conclusion, we talked about the roles and responsibilities, we talked about organizational structure, legal and ethical realms, funding, and lastly communication. Just to harp back on the theory, our thesis statement, so without all 5 components, you would not be able to, the public and community health would not be able to achieve their goals without these 5 elements. And here is my references. I appreciate your time and have a good day.